Hi everyone, my name is Raman and I shadowed a fourth year student who was on her infectious disease rotation at Banner. In this setting, the pharmacist is primarily responsible for ensuring that all the medications that are prescribed are correct for the patient's particular infection. Since each of the patient cases are different, the pharmacist has to figure out ways to ensure that the medication is tailored for each specific patient. For example, one patient had a Staphylococcus aureus infection on their eyelid, so the pharmacist had to figure out a way to create a vancomycin topical that could be used on the eyelid. Another patient had a Staphylococcus aureus infection on their coronary artery stents. So that was another challenge where the pharmacist had to work together with the resident and the P4 student to come up with a plan that would be applicable for this particular patient. Working as an infectious disease pharmacist does require a PGY2 residency. The residency program really allows the student to become more confident in dosing antimicrobials in an acute care setting. For the P4 student, their day starts off with just reviewing each of the patient charts on their own. During this time, they take notes on the medications they think would be effective for the patient's diagnosis. They also go through lab values that are available to see if the medication would need to be renally adjusted for any reason. Then after that, the P4 student meets with the medical team, which includes one physician, 2 medical residents, and a pharmacy resident, and they all come together to complete table rounds. During this time, they propose treatment plans they think would be effective for the patient's diagnosis, and they propose multiple treatment plans in case that the patient's condition is worse or better than what they expected. Once the table rounds are done, they all go and meet each of the patients individually and assess to see how their condition is progressing. On rotations on the infectious disease floor, the fourth year student goes through each of the patient cases to develop treatment plans depending on the patient's lab values or any other chronic conditions that they may have. They propose their recommendations then to the pharmacy resident, who will then come up with a plan to propose to the physician. Their hours are 8 to 5, Monday through Friday. Other than working up the patient cases, the fourth year student also does an antimicrobial stewardship project with the pharmacy resident, and they also learn ways to dose vancomycin correctly. The fourth year student that I shadowed really enjoyed her rotation just because of the variety of patients that she saw on a daily basis. She also loved the fact that she was able to work on an interprofessional team and really felt that the knowledge that she had was always valued by the physicians and the other residents. I am very interested in the infectious disease area of pharmacy because every day is different from the last. Every patient was unique, and that ultimately affected how different each of their treatment plans were. I also enjoyed how the environment was very fast-paced, but you still had the time to think through each patient case to develop the appropriate medication regimen.